Welcome back to episode 2 for Your Best Self, Dermatology plus Plastic Surgery. This is Dr. Novo. I'm here with our host, Jesse Hall.
Hey there. Welcome back, everybody.
Awesome. Well, I think we have a great episode today. I'm going to share a lot of our pearls on how we structure a consultation and the layers to that and what you might experience and what we'll discuss, and which pretty much summarizes our philosophy as a practice. We try to make a lot of useful tools for patients as well as our staff to help guide patients. So you walk away with a lot. You walk away with a treatment plan, which will include a financial breakdown. And we like to look at it not as cost or fees, but more of an investment. So that's kind of our approach. You know, some people might invest in fancy cars or bags or whatever they're into, motorcycles.
There's so much silly stuff to spend money on.
Yeah.
And unfortunately, health seems to always be on the back burner. Like it's just for emergencies only.
And so many people say, oh, they're later in their life, I put everybody else first, and now I'm going to refocus on myself. So hear that story a lot. But I think there's more of a trend to prejuvenation as well, where younger people are being a little bit more proactive, and we could do a whole episode on sunscreen. But that'll be part of one of the steps in the consultation.
And I'll also add one anecdote when it comes to sunscreen. If it doesn't have zinc oxide, it's doing nothing for you.
Yes. See, he knows more than he lets on about this biz. So we're definitely gonna get into sunscreen as one of the steps, essential steps.
So and I think a lot of listeners would probably, if they're curious about it, they may think, well, is it only for cosmetic, or is there like a medical thing that maybe I could use my insurance for? Like what ratio of cash versus insurance clients do you have?
So there are health savings plans that can be used for sunscreen and skincare. Absolutely.
Cool.
We've even done resurfacing for skin health, and it really depends on the patient and how they have their health savings. But I have a lot of people doing treatments and things for reversing sun damage and aging. But absolutely, sunscreen is a no-brainer. We encourage use of sunscreen as a health preventative. I can't tell you how many patients. They're there to talk to me about plastic surgery, but because our culture is so strong, we always start with skincare, and that kind of brings us into the tool of our consultation, which, if you can envision the shape of a pyramid, right? So we're going to start at the base layer, which is a regimen. Within your regimen, meaning what you do on a daily basis for your skin health, there's cleanse, and then the key step, protecting. So that's sunscreen, especially now with a lot more awareness of the ingredients we're putting on ourselves. Jesse hit it on the head. It needs to be a mineral-based sunscreen. All sunscreens are really well labeled as the active ingredient.
Right.
And you want to make sure that zinc or titanium dioxide, which are the mineral-based sunscreen. So that's going to be your protect layer. I just went through my closet and tossed a bunch of, we have visitors, everybody brings and leaves their sunscreen, and you want to look at those chemical ingredients, which will always start with A or O, the vowels. And the chemical, those are the ones that are harming our reefs and water, and they're really not good for our skin. So zinc or titanium are the top two. But yes, you can absolutely use your health savings funds for that protect step. So like I mentioned, our philosophy is like a pyramid, and there's different layers. So we're going to go over those layers, almost like you can imagine yourself climbing a mountain. Like, I'm going to start at the regimen layer, meaning that's my base, my foundation. So that foundation should really be 3 things: cleanse, protect, and renew. So you really need to cleanse your skin, which a lot of people don't understand is important, because you need to balance and remove the layers, the dirt, the impurities, so that whatever else you're putting on your face can work. So cleanse, and then you're going to protect every day. So many patients say, oh, I wear sunscreen if I go out, or if I'm going to be at the beach, or it's like, no. Do you drive a car? Yes. I cannot tell you how many patients I've removed, multiple skin cancers from the left side of the face, or their sun. Just start looking at people. Everyone's sun damage is so much worse on the left, just from driving every day in a car.
Right.
the exposure. And we live in Florida. You cannot avoid what we're learning about exposure, radiation, and reflection. Even our devices, the reflection of the blue light is actually more damaging than UVA and UVB. Blue light, that wavelength from tech, penetrates deeper and does more damage.
See, I thought it just affected the eyes, but you're talking about the skin.
Skin.
All right, listeners. There's going to be some more bombs being dropped. I had no idea about that. I know.
So
mind blown.
We try to do the heavy lifting and the editing. Dr. Saluja is always on the cutting edge of what is the best and the forefront of skin care, scientific results. That's why she brought in Isden, is our favorite sunscreen from Europe. In Europe, it's a prescription because it's considered therapeutic. So this ingredient in Isden won the Nobel Prize in Chemistry for repairing DNA damage that leads to future skin cancers.
Really?
I love it. I use it every day.
Next time you come in the studio, you're bringing some.
I'll bring you Isden.
I may not be able to wait. I may have to get some tomorrow. That's all. I'm gonna come see you.
Speaking, if you hear of a product, we do have a sister website, foryourbestskin.com. We haven't talked about.
Okay.
Where you can buy products that are curated in our practice, free shipping for purchases of $100 or more. So if you hear things we're talking about, you can check out foryourbestskin.com.
And that's very important.
That's our online store. So that being said, Isden is wonderful. It comes in a liquid, and then we also have a mineral brush, which I love just for on the go. It's always in my bag just to protect and reply. So we live in Florida. You have to protect no matter what you're doing. Wake up, wash your face, put on your protection, because we don't want to be. I love surgery, but I don't want to be cutting off skin cancer.
That's never fun. That can't be fun. And that kind of goes back to some other things, like while you're driving, if you wear hats, sunglasses, if you can, like
I
for
always
me,
drive with my hands like covered or underneath. Yeah, just the back of your hands. If you just drive, you see it's just getting exposed.
So no more 10 and 12, or what are the 10 and 2?
Or gloves, driving gloves.
Use some driving gloves. Okay.
Sunscreen.
Exactly. Put some sunscreen on those hands, people. Come on.
I'm sitting on my hands right now.
So you know what I do is with my vehicles, I put on the reflective tint.
Yes.
That blocks a lot of those things, and even the front. I have this. It's a product. It's a clear tint, but it's ceramic, so it's blocking a lot of those harmful rays, and it also keeps the inside of your car much cooler, because here in Florida.
You need a plug for a tinting.
Yeah,
company.
I know, right? Maybe that's a potential sponsor.
There you
go. And so, but you bring up a valuable point too: reflection.
Yeah.
Even if I'm wearing a hat.
Right.
And I am fishing all day. It's coming right up from the water.
Yeah, those buffs. I tell all my patients to get those face protection. Clothing is a really good barrier. There's a lot of money being spent on UV clothing, but which is good. It's not going to hurt you, but at least having a layer.
Yeah, I like the SPF 50, shirts, and like your husband Rob, we tend to be in the water a lot, so all my rash guards or even have like a SPF rating to them, because it is important.
Yeah, and I think protection is. People don't care as much how they look. It's like Rob goes out with the hood. He's like, I don't care. I nag him. You have to be protected. So he's like, I might look silly, but I don't care.
Well, and he's going to be young.
Yeah.
And he's going to be 70. People are going to mistake him for 50, and it's going to pay off, right? At least that's what I convinced myself of. I'm like, I could look ridiculous, and and I don't mind wearing like technical clothes, that pretty much look like I'm going fishing or I'm outside all the time.
Protect.
Because
sunburns are not in style anymore.
No. Sunburns, even like deep tans.
Right.
Because we all seen the grandmother and who's had overexposure, and it's like, it's like a leather purse,
right?
It's like.
But it's amazing how behind we are being in Florida. How every day I hear I don't wear sunscreen, or I do if I go out, but it really has to become a part of your routine to protect, especially the younger the better, to protect.
When you say regimen, what kind of cleansers should people use? Bars of soap aren't going to cut it, right?
Right. I think it depends on your skin. You know, there's gentle cleansers that are going to remove oil without being too harsh. If you're acne prone, there's going to be different ingredients you may not use every day, but it might have a little salicylic or glycolic, or it might be exfoliating. So that's why a custom consult is really critical, because not all face wash are created equally. You know, you can get decent things over the counter, or you can get something that might be a little bit more sophisticated as far as the ingredients if you come into a medical office. I think the key is using a cleanser, and then we can talk about, you know, tailoring it to your specific skin needs. You might have two different cleansers, you know, one for your oily days, one for just to be gentle, and if you fluctuate.
In my spa career, I was given like the crash course on how to do a facial, and that was the primary thing. You know, we try to offer a little consultation as estheticians. You know, is it oily? Is it a dryer? Is it rosacea or some other sensitivity? What's going on with this, with your complexion? And so then we would tailor, the different products for, what we're trying to do in the effect and the result we're looking for. But there was like 5 steps, and maybe this is just once in a while, and correct me if I'm wrong, but you want to cleanse. You also, somewhere in there is exfoliate, and you're going to tell us about what that routine looks like, how often is safe, and what's overdue. And then you want to mask.
Hydrate,
right? And then you take off the mask, and then you tone, get a toner and tone it. Yeah. And then you moisturize, and that should be the last step.
Right.
So 5 steps in a facial, but what looks like a proper regimen for the daily person? Like, if they're going to do this twice a day.
So if I were just to keep it super basic, as in like the core essentials, it would be the cleanse, protect, and renew. And by renew, our favorite tried and true product is retinol. And so a vitamin A derivative that's going to speed up cell turnover. You can get it over the counter. What you can get in a medical office is prescription, but it's going to be 100 times stronger.
Sure.
So you can't compare results with 1 times 100. So the goal with your retinol or tretinoin is 5 nights a week.
Okay.
And that's used at night. You may have a little bit of flaking, a little bit of peeling. You don't want if the peeling is so excessive that you're not going to use it, we'll usually go down on the strength, because the goal is 5 nights a week so that you can build collagen, improve cell turnover. It's going to work on decreasing breakouts if you're acne prone. It's going to work on improving texture, decreasing fine lines, building collagen. So it is the workhorse for anti-aging and complexion, and also removing some of that sun damage. So we usually, the only reason you wouldn't be on it is maybe a severe rosacea or pregnant or nursing. It's contraindicated for childbearing. So really the essentials are cleanse, protect, renew. I'm glad you brought in toning, because if you're going to start layering, I think that's the next thing I would bring in, because depending on the pH of your skin, different products are going to penetrate and work better or worse. And then the next layer would be something for anti-aging or antioxidants, depending on where you are in your skincare budget and our goals.
Correct, right?
So you have to have what you're willing to spend on your skincare and your lifestyle. Some people want all natural. We have a phenomenal all natural line. Dr. Suluja developed her own line.
Is that right? Cool.
Suluja MD. So hers is all natural based. Phenomenal products. I'm obsessed with her luminosity oil in particular. It's just, the smell is addictive. The hydration's addictive. But we could do a whole episode on Suluja MD. Maybe we'll do that.
Yeah, coming up. So make sure you subscribe out there to those listeners, because more cool insights to come. So with toners, I mean, you can find some of these things so affordable. Like I get like a Neutrogena Gentle, you find at Walgreens. For toning, real easy, just like a witch hazel, can do the work.
Right.
And witch hazel, actually, you could do, like, it has multiple applications. Like, you use that stuff like, like Windex. Like, yeah, exactly. It's like one of those things. So, and then just get a good moisturizer.
Right.
You know, get a 2 times a day and night cream. And you can find those over the counter.
Look at you. You could come work for us.
I should.
Work with us, I should say, not for us.
I should. No,
Our new ambassador.
But I'm passionate.
Yeah.
I mean,
it's all it takes.
You know, for those watching on YouTube.
Look at him. Just look at him. He's hydrated.
My wife is so jealous of my complexion, and you know, it's only because I learned this when I first got my massage license, and you know, worked on board cruise ships and in the spas, and I was just surrounded by not only lots of product, but also a lot of knowledge. You know, I mean, there was like 4 or 5 girls in the spa that's all they did was facials, and again doing massage, and on our free time, it's like, hey Jesse, come over here, I want to show you something. And so I just kept on learning, and eventually, you know, through osmosis, through working in that environment, I learned how to do it, and. Awesome. Yeah, and
so you're committed. You're a believer.
I am a believer. I am a believer.
It takes consistency. So many patients that come in. I have so many products. I don't know how to use them, so I don't use them. I don't know what to put on my face. So it's like, bring them in. Let's take a look. You know, if you're not, it's like use it or lose it. It's not doing any good on your shelf. So, you know, make sure you have your essentials. And I think just really that organization and structure. People are so overwhelmed with the Sephora. I mean, you walk into a Sephora Ulta and it's just like, where do I even start?
I know.
And that's why I think we've done a really good job of curating what works. If we don't think it works, we're going to find what works and replace it. That's why we have one eye cream. You know, we don't have 20 to choose from.
What would it look like? I'm sorry to interrupt. What would it look like if somebody just wanted to come in for a consultation just to learn which over-the-counter common CVS, Walgreens,
I don't know if we'd tell you to buy over.
Well, you wouldn't, but let's just say they bring in their own. Like my friend said to use this, and it's like this isn't for your skin. You know, I mean, you could just do a lot of justice for some of these people who just collect, you know, product just because one friend said this and one friend said this and this what. Not everything that your friend uses is going to be good for you. Right. So and maybe
we're actually creating a post along those lines for Instagram. Basically, like you could buy and use these 10 products, or you could invest in this one product and get the power of these 10 products in one product, simplify your life, and therefore get consistent and get results. So, so people could consult with our patient educators or estheticians. Chances are, you know, I'm not saying over-the-counter products are bad. Maybe having all over-the-counter products is bad. Maybe we'll introduce something that's medical grade and then build from there. But really, like I said, it depends on your goals, financials, what you're willing to invest in your skin for results.
Yeah, some people do have a more fragile, let's just say, you know, skin under the eye and around the eye. You know, some people just have like really thin, you know, skin anyway. So for them, maybe investing in a good serum, something that's going to tighten, strengthen, and firm that skin type would be better. And some people are just, you know, maybe they're just fair skin, so maybe you should invest in a really good conceal or protective layer.
You got it.
You know, so
I got a ringer here.
You're so funny. You had no idea. I could talk skincare for a little bit, and as you know, a lot of my friends call me Metro when that was a thing. Remember the metrosexual? Yeah. Because I'd have like a routine, and they're like, "Why are you walking around with a green face or a brown face?" And I was like, "This is a mask. I'm hydrated." And they're like, "Oh, dude, you're so Metro."
You should do an episode in masks.
Yeah. Well, there's so many of them.
Yeah.
You know, and there's different applications.
Yeah.
You know, there's hydrating masks. There's the exfoliating mask. I mean, there's a mask for, you know, different skin types. Yeah. Not everybody needs muds. Maybe you need a seaweed. You know, who knows?
Yeah. So the next step actually in our pyramid is to resurface. So along those lines, you know, a good facial, and there's facials and then there's facials. You know, there's feel-good facials and then there's kind of more therapeutic facials, which shouldn't feel bad, but it might not just be a relaxation facial. So we have a lot of those tools in our office. Hydra Facial being one of my favorites. If you've not experienced a Hydra Facial, it's the most clean your skin will ever feel because it's a suction and extraction.
Ooh.
And then it's also an infusion. So it's this like cyclical suction of anything in your pores. And then it will infuse exactly what you need, customizable hydration or antioxidants. It's amazing. So
sounds
you like
amazing.
won't want to stop. You're like, I know I shouldn't be touching my skin, but I can't stop touching my
Just
skin.
use the back of your hand.
So we have the Hydra Facial, which I'm a big fan, and then chemical peels. You know, there's levels.
Very familiar with those, yeah.
Our estheticians do chemical peels. So we recommend, you know, doing a peel depending on your goals. You know, if you're trying to cure some severe pigmentation, it might be a series every month, or you might just say, hey, I'm going to do a quarterly peel, one with each season. You know, it's kind of how we look at it, to really refresh the surface.
So every 90 days. So this isn't something you need every week.
No, because you're going to have a peeling process, and not everybody
Right.
can walk around like that. But also the peeling process will depend on kind of what state's your skin in. But we love the peel. We love the Hydra Facial. We love Hydra Facial in combination with Derma Planing, not to be confused with Derma Blading, which is the kind of trending brow treatment.
Right.
Derma Planing is when you take a surgical scalpel and scrape off the top layer of peach fuzz and dead skin cells. And the combination of those two things really can jumpstart the penetration of a good skincare regimen. So that can be done like once a month if you have the time. Chemical peels every quarter, and then depending on where you're at in your skin health or age, you know, we have more things like the more aggressive resurfacing and the deeper peels that I would do or Dr. Suluja would do for you. And then there's always things for maintenance like the microneedling for collagen stimulation. So after skincare, then we're talking about let's start really working on the skin health and skin quality with some different tools. So those are the first two layers.
So you've heard it here. We're going through the R's. We've done the regimen. We kind of didn't get into your garden analogy.
Oh, we love analogies.
So real quick, because I don't want
analogies
to
make sense to
backtrack too far.
everyone.
Right.
Okay, so garden analogy is like when you're going to spend a lot of time on landscaping and bring in all these fancy shrubs and plants, but then you're not going to invest in the person that's going to fertilize and water. So the fertilizer and water is really your skincare regimen. So you can't skip that step, right, to grow a beautiful garden, which is your skin.
I like that. And another, fact for all those inquisitive people out there, skin is actually an organ, and it's actually the largest
organ of the body. Absolutely.
I thought that was so fascinating. Because people don't know this too. Just like it extracts impurities, and we've all seen, some complexion issues with acne and other things. But it also absorbs what you're putting out there. You can put again. That's why the ingredients matter. And we some of the things you could even use with like essential oils, like topical creams, and those things are absorbed immediately into the bloodstream and can have a like an instant effect.
Right.
Yeah.
Definitely.
So regimen, resurface. What's the third R as we go through
it's
it?
one of our favorite steps. Relax.
I'm relaxed listening already.
So relax is really how we refer now to your Botox, your Dysport, your neurotoxins. So technically it's a family of neurotoxin. Nobody really likes to hear the word toxin.
Right.
But it is a derivative of purified botulinum toxin, which is a very specific muscle. It's a targeted muscle relaxer or paralytic because it's blocking the neuromuscular junction of release of acetylcholine that's going to stimulate that muscle. So Botox is almost a household name by now.
It is, yes.
So Dysport is, we use it almost synonymously. It's a different brand. And then the newest brand is Jeuveau, which is using the only newest updated processing technique of that protein. So it's the same protein, but a different purification process. So the thought is that they're going to have less inactive protein because it's filtered. So Jeuveau's the newest neurotoxin, Newtox, but they're all neuromodulators. So they're used in medically as well as cosmetically. They're placed in very specific locations to we don't say paralyze, but soften. The trend is no longer to be frozen, even though some people might like that. We say we're going to soften. We're not going to eliminate wrinkles, creases, lines. That takes skincare and resurfacing and filler. But we're going to soften the appearance of dynamic wrinkles. So most famously, it's the scowl, you know, your 11s or your forehead lines or your crow's feet. Basically, anywhere you have a muscle that you animate, you're going to get lines perpendicular to that.
Yeah, that makes sense.
So we're going to place it strategically to soften that animation so that you can't deepen and exacerbate those creases.
Gotcha.
So that's why there's kind of a whole movement of younger people doing Botox, this kind of prejuvenation movement,
Right.
where you might go in and get a lower dosing in different areas so that you don't have time to form those deeper creases, if that makes sense.
See, I just got educated. I really thought Botox was like a filler.
No.
That would just fill in the space. But what it does
It's
is
a
a relaxer
Yes.
to have those,
Very different.
as you called it.
It might look filled
Right.
because it's softened
Okay.
and you're not forming those creases.
Sure.
Mine's wearing off.
I like
But-
that.
But even if you look at trends in Hollywood, like
Mhm.
people don't want to look fake or filtered.
Right.
They want to look authentic and healthy,
Right.
age appropriate, but good. So you want to look refreshed, relaxed. Does that make sense?
No, absolutely. And now with 4K, high definition, you know, makeup is so much more important. Lighting is so much more important. And getting the right dosage, the right application
Right.
of skincare, because yeah, you know, old Hollywood was just tons of makeup and tons of
Cover it
plastic
up.
surgery. Just
Yeah.
and you could wear that mask, you know,
Right.
and but yeah, nowadays I think, you know, nobody wants to look like that overdone,
Right. Or like,
overzealous.
I can't emote.
Yeah, I'm 80, but my eyes are peeled back like I'm 20. And so yeah, there's age appropriate, and I'm so thankful you have a term for that. Yeah.
So that's really our relaxed step. So that is a very common confusion between filler and Botox, like where you put it, why you put it, you know, like, oh, they put it here, you know, they'll point to different places, and you really just have to educate and empower people to know, like, you should know it's being put in your face. You should know why, what it does, or, you know, I think one of the most common things is Botox for a brow lift. You know, if you eliminate all the lines on the forehead with Botox, your brows are going to go down because that's a eyebrow raiser. So there are techniques that you can use to lift the brow with Botox or just Porter Javot, but you really have to educate that if I erase all of these lines, which is tempting, you may be unhappy because your brow is going to relax and your eyes, you know, your lids will be smaller. So
Yeah,
it's
there's
things like
adverse
that.
effects.
Yeah. So it's a balance, and I think dosing is important,
Right.
and obviously placement is important.
Placement, dosing, yeah, because you may, you know, in say, for instance, a clinical practice, not like a, you know, one of those Botox parties. In a clinical practice, you're
Glad
gonna
you
put
brought it up.
yeah, you're gonna put that, you know, whatever. And I'm just hypothetically, you know, speculating here. Whatever it is, like say a 3% right above the brow, and maybe like a 10 or 15%, you know, in another more concentrated area, right? I mean, you could formulate dosages like that.
Yeah, it's not necessarily in percentages, but definitely units.
Oh, units.
So we
Okay.
talk about it in units, and you know, it's gonna be totally customizable based on your strength and goals, like what you're trying to, your anatomy and what you're trying to relax. But I'm glad that you brought up the Botox party topic, because part of our brand is safety,
Right.
along with skill and synergy. And we determined very, very early on, and Dr. Saluja, you know, adopted a lot of this from her previous practice, that we would not do filler outside of a medical setting. We will not be in spas or salons or homes
Good.
doing filler, because it's a medical procedure,
Right.
and you have to be sterile. You shouldn't be anywhere that they're, you know, processing nails or things like that.
Yeah.
You really have to have the appropriate medication in case there's a complication, which you have to have so many amount of vials. And we've been in situations where we've had to actually lend it out. So you have to be prepared and have that appropriate amount of medication in case filler needs to be dissolved in an emergency. So we adopted very early on that we would not do filler outside of a medical office. We will host Botox events or pop-ups through collaboration with different brands and things. But again, cleaning the skin, making it, with surgical soaps and alcohol, wearing gloves, and, just you really should know what and where and how things are being injected.
Yeah.
The setting is important.
Exactly. If you're surrounded by a lot of people drinking wine and eating finger food, and then they grab a syringe and want to start poking at you.
As we all know,
that could
people
be a red
make
flag.
poor judgment under the influence. So we will not inject if people are drinking. It's just
contraindicated.
More likelihood of bleeding and bruising. Alcohol thins the blood. So, yeah, contraindication.
Yeah, that's not good. No, I've had that experience. Working on cruise ships, I had some very inebriated people wanting to rub on. I said, I can't do that.
Yeah.
Like it's so unsafe.
It's important to say no.
It's important to say no. We learned that in episode 1.
Good.
So, well, listen, we're kind of closing in. We got to tighten this last few minutes up, and we still have 2 more topics.
3. Oh, we did relax.
We did relax. So,
Refill.
So let's get the cliff notes of Refill and something called Redrape.
So Refill and Recontour, and then the pinnacle Redrape. Refill, Recontour is really when you're going to look at ways to restore volume or contour with different things like Hybella. Redrape is when ultimately you need to remove skin or surgically alter underlying architecture. So we like to move you kind of in a progression when surgery may be the final answer. But again, that always depends on the patient when they're ready for that. Yeah,
you don't want to skip through all those other steps and go right to surgery when maybe, just maybe, a microdermabrasion or something like that could be the solution.
I've told many surgical patients we need to work on your skin. Because Saudi surgery will not look good or be the best result or last without good skin quality. So.
And having worked with a doctor, an orthopedic, in my early massage career, it was that same thing. You could come in and get a surgery, but it's all about the rehab.
Right.
You could rehab through an injury. You don't have to go jump to the surgery. But there were some people who just, they trusted a doctor. A doctor, of course, wants to, get the most bang for their buck. So, of course, let's put you on, anesthesia. Let's put you in a hospital. Let's milk that insurance. And then guess what you're going to do after your operation?
Not rehab.
Post-op.
Yeah.
Rehab.
Injure yourself.
You're still going to have to do rehab for that patient. So you may think you could skip rehab, but you're really not. Yeah. All you're doing is getting cut up and having something removed that maybe doesn't need to be removed. That's all.
Yeah, we're looking for longevity. So
exactly. So
it's a ladder or a pyramid.
Don't get those ectomies. Don't have everything removed.
That's right.
When you could just do some common services.
Yeah. We all believe the most attractive thing is good skin. Mm-hmm. I mean, good, healthy skin.
It's your first impression.
That's right.
Yes. And it stays with you forever. You can't walk around with a bag over your head. Any final thoughts regarding your consultation and the 5 R's of your consultation?
Are we going to break or we have more time?
No, we're just about out of time. Yeah, we're on our 34th minute.
Oh my gosh, we're over.
So it's okay. It's okay. Listeners, sorry we went over our prescribed 30
every layer
minute.
its own episode.
And we will. We're going to elaborate on all these topics. So importantly, where could they find you and how could they get in touch if they want to?
All right. So website, foryourbestself.com. We're on Instagram, Dr. Saluja _Dr. Novo. We're on Facebook /Dr. Saluja. Mm-hmm. We're all those places. Our phone, if you want a consultation, is 321-241-1160. We have tons of awesome, educated, informative staff that really want to see you get results too. So call and make a consultation.
There you go. Well, doctor, another successful episode. We hope you all enjoyed our conversation. And yeah, tune in for more. Make sure you hit that subscribe button, and make sure that the For Your Best Self podcast is part of your favorites. And not for nothing, but you may want to adopt some of these lessons that the doctor is offering.
Prescribing.
Yeah, prescribing. I like that. The doctor prescribed it. All right, guys. Till next time. We love you.